Hi guys, Kane Harrison here. Welcome to Nashville Health and Wellness Program. I'm delighted to have Dr. Jeffrey Marvel here today from Marvel Cosmetic Surgery. Welcome, Doctor.
Thank you,
We are
Kane.
going to talk about the body. We've already been through breast augmentation, and as you guys know, we work really closely with Dr. Jeffrey Marvel on a lot of his products and services. But today we're going to discuss the body, and mostly tummy tucks and some liposuction. But let's start with the tummy tuck, which is probably the biggest of them all. Talk a little bit about it.
That's one of the bigger surgeries that we do. It's an elective surgery that you can still have and go home that night.
Mm-hmm.
But these are big incisions. Oftentimes they go from hip to hip.
Mm-hmm.
We break them up into what we call a full abdominoplasty or tummy tuck. Those words are kind of interchangeable. And the full, let's just say call them tummy tucks for today. The full tummy tuck would be revising the navel, repairing the muscles internally, which is basically from stem to stern, from the top of the rib cage to the pubic bone, and then excising all extra skin. So that is the big procedure. Then there's what's often referred to as mini tummy tucks,
Mm-hmm.
and that category could include a lot of different things. Usually that's a smaller incision, maybe not as far across the lower body. May not involve revising the navel. It may not involve as much of an extensive muscle repair. So the ideal person for a tummy tuck is a patient who has primarily weak muscle and loose skin. It is not an ideal operation for patients who still have significant amounts of abdominal fat. They're either good candidates for more dieting, or if they're at a point that's not going to work anymore, and if they're not too heavy, then liposuction is something we can talk about later.
Mm-hmm.
But so it's a procedure that corrects loose skin and muscle weakness, and it's the ideal procedure for that. So who are those folks? They're usually more likely to be female than male because women do carry children, and pregnancy and carrying children tend to separate the muscles as the fetus develops and grows inside the woman. The muscles typically separate, and they don't go back sometimes.
Yeah.
And some patients don't even gain a lot of weight, but their muscles can really be splayed apart.
Mm-hmm.
And they can do all the setups they want after their pregnancy, and they still have that maternal-looking abdomen where it just doesn't go back flat again. And so they're an ideal situation where you're going to pull the muscles back together and tighten them. It's like an internal corset where the muscles are pulled together with permanent suture. Also, some women get a lot of stretch marks, and those are very unattractive, and there's just no way of getting rid of that. There's no lasers or creams or anything that's really effective. So a tummy tuck oftentimes can remove 75-80% of those stretch marks, because we can remove most of the skin from the navel down, where a lot of the stretch marks are going to be located. So that's another advantage to a tummy tuck. Other good cases are people that have maybe sometimes multiple surgeries, different surgeries, multiple scars, where they just need a clean slate,
Mm-hmm.
And sometimes they can simplify and get rid of some complicated scars and just get down to just having maybe one scar, and having, again, the muscle repaired where the muscle's been weak from multiple prior surgeries. So it's a very rewarding surgery for the right person, the right candidate. It is a bit painful. Some recovery is involved, of course. No sports, weightlifting for about 8 weeks. But usually you can be driving your car in about 7 days, but nothing too strenuous. Sometimes off work for 2 weeks.
Yeah.
So a little bit more investment in terms of time off and discomfort from the procedure, but nothing really gives a person a new lease on life as a tummy tuck can.
And I imagine often that it's at the end of a long journey, as you say, whether it's motherhood and having a family, or perhaps also weight loss. I mean, coming through that journey and still having done all that hard work, but just having that last little piece that you just want to fix up.
Yeah, and that reminded me, Kane, that there is we call the post-bariatric patient. That's a whole new category of the patients nowadays that may have lost 100 pounds or more,
right,
that may have had bariatric surgery, such as gastric sleeve or gastric bypass or lap banding surgery. And these are very challenging because, they might have lost, I've had patients lose in excess of 150, 60 pounds, and, their bodysuit doesn't fit them anymore.
Yeah.
So they're having to have not just tummy tucks, but lots of things. But yeah, they're at the end of that weight loss journey, and they just need a lot of skin removed. And like other things we've talked about in our prior shows, this is a procedure where, need to be done having your children.
Sure.
Don't want to have this done and get pregnant again right away. So this is a procedure when you're through having your babies. If you're going to need it, that's the time to do it.
Absolutely. And so moving forward, something else that one of the products and services that we market here, Slim Lipo, which has been a great success all around. A lot of interest has been sparked through our Facebook advertising, and a lot of great comments in how it's changed so many people, both men and women. Far less invasive surgery, recovery time far less as well. And majority of the comments we're seeing, which I'm sure you can go into, it's people who have really looked after themselves, really trying to remove largely some of this excess body weight around their abdomen and stomach. And this is kind of just sealing the deal. They'll come in and see you and have this fantastic procedure, and then they're done with it. But explain a little bit about Slim Lipo.
Well, yes. Some of the patients, they come in and say, I just don't really want to have a tummy tuck.
Yeah.
I do not want that much surgery. I don't want to be off work that long. I don't want to go to sleep. Be surprised at how many people are just fearful of a operation.
Sure.
They don't want that loss of control of being put under general anesthesia, and that there's just that fear of something like that. So there's many patients like that. They want an alternative to that. And sometimes Slim Lipo can offer them that alternative. I've been doing liposuction for 20 years now, and when I introduced Slim Lipo a few years ago, I was just amazed at how much better the results were than just traditional liposuction. Cases that I would have years ago thought the only thing that's going to help this person might be a tummy tuck.
Yeah.
Getting so much more skin tightening with the Slim Lipo that I've got cases that would turn out almost looking like they've had tummy tucks, without the big incision and so forth. So, there's that category of people. Then there's also categories of people that, I just saw a couple people like this in my office today that just are very, very fit, and they just have a couple troubled areas and it's not going away. Maybe their muffin top on the lower back just kind of hangs over the jeans. Some people are serious runners, and they still just have a little troubled area. And it's just not going away, or they would have to do such severe crash dieting that's just maybe it's not practical for them
healthy.
to get that low on their weight.
Absolutely, especially if you're a runner and you need some resources. But the beautiful thing about lipo is that the fat is gone. It's gone for good, right?
Yeah. When they get up off the table, a lot of them get their iPhones out and can I take a picture of that? And they get up against the wall and they want a picture of their fat to see what they're leaving behind.
Yeah.
And that's what I like about it. It's unlike a lot of these other treatments out there on the market today, where they kind of wave a wand over you and this is going to make you thinner. When you get up and leave from having lipo, your fat's, it's in the bottle.
Yeah.
You can see it. So everybody gets smaller. There's no hocus pocus maybe. It's there. The results are definite.
And without getting too technical, but there will be some people who have perhaps not heard of Slim Lipo before. And I know you mentioned this, it has been something where the technology has changed drastically, but there's aqua lipo, there's all these other things. Just explain the difference between perhaps even traditional liposuction and this new Slim Lipo.
Well, as I said, I've been involved with liposuction for about 20 years now, and what we've been doing for many years is termed tumescent liposuction, which is essentially a very wet technique of doing liposuction, where we put a large amount of fluid in prior to suctioning the fat. And that fluid contains the numbing anesthesia. It has medications that stops bleeding. And so that's somewhat similar to the aqua lipo. The aqua lipo is putting the fluid in with a little bit more force. So that's been around 20 years or more. Then the next thing that came around maybe 10, 15 years ago is ultrasonic liposuction, where they were using heat generated by ultrasonic waves to kind of melt the fat. And that's been still done quite often. And then I guess the next generation of liposuction was the introduction of laser energy. And Slim Lipo is one of those technologies. Slim Lipo is two lasers in one. Lasers are classified by the wavelengths of the laser energy that's delivered to your tissues. And this one has one wavelength that's more designed for skin tightening and one more for fat melting. So every time we do a case, we actually program in how much skin tightening and how much fat melting do we want to get.
And the skin tightening didn't happen before, is that right?
Well,
as well?
No, there wasn't much skin tightening at all. It was just a matter of suctioning the fat, and then the skin would naturally tighten up. You know, just like when you lose weight, you know, your skin naturally will tighten up. But this is, you know, this is taking it a little bit step further. It's using the technology of the laser to create more skin tightening. Not only fat melting and fat removal, but skin tightening. So that's really what the Slim Lipo, and right now that's where we are. I don't know of any technology any further more advanced than where we are now than laser liposuction.
Well, and so we're talking about tummy tucks. So we wanted to mention mummy makeovers, which we had talked a little bit about briefly before in another episode. But let's go into it a little bit. We've heard about mummy makeovers all over the place. Largely, it is a breast augmentation of some sort and a tummy tuck, which can be a number of different things, including a non-incision breast reduction. So can you just talk about the mummy makeover, what it kind of entails? And then we'll go into perhaps the less invasive type stuff like the non-incision breast reduction. Well,
a mommy makeover could mean different things to different people maybe, but basically that's the patient who's, again, done having their kids and they're coming in and saying, now I want to get my body back. Typically that is a combination of cosmetic breast surgery combined with some form of abdominal procedure, usually abdominoplasty. Or we often will do combination of, say, Slim Lipo with breast surgery. So it could be breast implants and Slim Lipo. It could be breast implants with tummy tuck, or breast lift with tummy tuck, or some combination of getting back the pre-mommy body. That's pretty much what the mommy makeover is. So it's just kind of a slang term to describe getting back the pre-mommy body. But there are different combinations for that.
Sure, and I think one of the really incredible things, which I'd love to touch on, is the non-incision breast reduction, which stems for, which we'll go into further episodes, I guess fat transfer and things like that. But just talk about that.
Well, and this is a procedure that I've kind of made something that I somewhat specialize in over traditional breast reduction. We talked about that on a previous show, but and it came about somewhat from using the Slim Lipo laser. And again, my 20 years of doing liposuction, I've done liposuction on breast before and gotten pretty good results at reducing breast without making all the incisions. But using the powered liposuction, which is the vibrating cannulas, which is the way to remove the fat, in combination with the laser, the Slim Lipo laser. that we were really able to shrink the breast down significantly and get skin tightening with the laser, so that we've been able to significantly reduce the breast without any scar tissue. More so than I've ever been able to in the past by doing just plain liposuction. So now I got patients that see it on my webpage. They've seen some of my befores and afters there, and are seeking me out just because they really want that operation.
Wow.
Because as you can imagine, breast reduction can create quite a bit of scars sometimes, and there's quite a bit of time off work. You know, sometimes there can be wound healing issues, and the women can't smoke. There's some issues with that. With the non-incisional breast reduction, that's not an issue, and they can do it without being placed under general anesthesia.
Wow.
They can actually do that with just some sedation anesthesia. They can be back to work on the second or the third day. You know, and for many, many cases, they can reduce the size of their breast by 2 or 3 cup sizes. Much less cost involved, much faster recovery, and again, the absence of any visible incisions.
Well, we know fat transfer is a big topic, and that is what we're going to talk about next in our next episode of the Nashville Health and Wellness Program. So thanks, Dr. Jeffrey Marvel, for coming in, and we'll see you guys soon on the Nashville Health and Wellness Program.